Okay, good morning, everybody. We are going to open a very important file today, which is about the DMS. DMS means Document Managing System. Management System is linked to patients, but it's also linked to all what we are dealing with every day, like the items we are using, the expiry date and all that. And we need to manage all these things that we are managing working in the medical field. So first of all, what are the problems? We need to control the items orders. Controlling the item orders is linked to defining what are the items and how we order them. This is important to know and important to track, and I will show you how we've been ordering, we've been creating a system to look at the items in a good way, to store them and to find them easily. In most of cases, patients, the assistant is calling the vendors and they are ordering things step by step like this, but there is no tracking. And we absolutely need to have a tracking on all what we do today, because if we have no tracking, we are not working in conformity with the local medical authorities. These local medical authorities are DHA or HAAD or MOH or any Ministry of Health in any other country. So we have to know about that, and we have to do in accordance with the conformity of and the requirements of these medical authorities. So you are not going to take care of that, but we are going to take care of that. We are going to make tools that you can work on, being sure that you work in conformity with the local medical authorities. That's very, very important. So you need to control the traceability of supplies. For that, you need to have the step-by-step, starting from the purchase order. Then you go to the delivery. Then you go to the payment. Then you go to the inventory. Then you go to the expiry date. And then you go to the patient's use. I'm sure that if you are seeing that, oh, I have a tool, I can do it myself using an Excel file, you cannot go through all these things that you need to do. And you are not working in conformity. So be careful for that. Use the right tools to do it in a right way. What is needed by law, what's needed is to have a real on-time evaluation of the inventory. If you want to know what you have in the inventory, if you want to know how much you have in the inventory, you need to ask the accountant to do it. But with this system, it will not be needed. Not only it will not be needed, but we are going to propose you something. In one click, you get the real evaluation of your inventory. And most of our clients working on the inventory like this have been able to save a lot of money, because you have in your drawers, you have in your closets, a lot of tools that you will never use or that will expire very soon. We need to track the expiry item, not only to know which item I expired and where they are, but also to be sure that in the next month or in the next 2 months, if you have some items which are going to expire, we need to order new one, or we need to use them as fast as possible, or you need to throw them away because they are expired. So that you can get online information, not only on what's expired, but you can also be warned by email when some items are going to be expired, and this is automatic also. You can, if you want, if you're interested in prices of item, you can compare the price of several items, same items sold by different distributors. So you have also some need to work in a medical legal constraint on supplies order. This is important for sterilization validity. I am not going to cover the sterilization today, but I am going to cover all about the rest of supplies. So the problem also is to evaluate the item consumption. Can you tell me immediately how many implants you have been placing last year? How many implants you've been buying? How many boxes of masks you've been buying? All that can be done in a very simple way. Not using Excel file again, but using proper tools developed for that. And also, you can link all the supplies management to the VAT and to the accountancy. No need to write things twice. When something is paid automatically, it can be linked to the accountancy. No need to export any Excel file. You click on, I have been buying this thing with this VAT amount by check today, boom. When you click save, it goes to the accountancy. I will not go in that today, but I will make a special webinar on how to link your activity to the accountancy automatically. One thing which is very important, and it's been left by the side by a lot of document management system, is that when you link something from the purchase order, you need to go down to the patient's use. And this is valid for all what you are using. For example, I'm buying an implant. I need to know where is this implant, in which body, in which patient, in who it is. Okay? So we link what we've been buying to the intervention, to the surgical intervention. And that needs to be done because legally speaking, we need to know the tracking of what we are placing in the patient's body. I will show you how we do that also. Of course, I've really focused on that. We need to work in conformity with the local medical authorities again and again. And they are extending that today for the patient management system with the NABID obligation to be under NABID control by the end of the year. So we are currently developing a program which will be NABID validated. And I'm going to show you that later. But already now, we need to work on the supplies in this way. And finally, final point, I will go slowly on that also, because we will have no time to cover everything in deep, is the security. As long as you work with patients, you need to work in such a way that you will be HIPAA compliant, means that you cannot reveal the name and the address and the telephone number of the patients and what they have and the diagnosis and the treatment. This is absolutely needed to be under control. This is one thing. The second thing is the security about someone who could get access to your files. So this is the reason why we in phase on the fact that it's better to work online for security reasons than to work on a local network that any good hacker could hack you in a very easy way. So this is why our system is protected by a license that we buy every year, which is called the Wildcat. And these licenses are SSL licenses. This means that all your data are encrypted one time, and the encrypted data are encrypted a second time. So in this way, it's exactly in the same way that you are protecting your payment when you use your credit card. We are at this level of security for your patients and your orders and for the link to your patients. So working on items and supplies that you buy is important in different kind of activities. It's important in the medical field, like an hospital or a medical clinic or something like that. It's also important in dental clinics, and it's also important in dental laboratories. So all these, they have different software, but all of them they include the planning of orders and the tracking and the inventory of supplies. So all this is the same for all this one. In some cases, someone is specific of one thing, someone is specific or another one, but in the case of supplies, it's exactly the same for all of them. So we propose to you to work in three ways. The first way is the everyday practice. All these buttons are in blue. So when you click on planning orders, you are going to prepare what you want to order. When something is ordered, you go to sent order management. And in sent order management, when you receive a box with something inside, you will manage this order and manage the payment of the order if needed at that time. And then automatically it will go to inventory and traceability. And I will show you that in details. And when you want to link what you are using with patient, you will go to baskets. Okay. So of course we have sterilization, we have orders to the lab, we have the online storage, we have renewal and tasks to allow you to know what you have to do and when you renew your licenses and all this. All this is included in that. Today we are going to talk only on supplies. Then you have automatic reports. No need to make computer things difficult or what. You can click on quick inventory and you know immediately what's the amount of the inventory and what you have in inventory. No need to ask the accountant. One click, it's enough. You know, you will have the dynamic inventory report allowing you to know how much you are buying, how much you have in inventory, and this will allow you to understand if you increase the amount of inventory or you can control them in a better way, decreasing that. And what you can do also, you can do some export of supply payments, so you can export in Excel to the accountant, or if you are linked to the Zoho accountant system, all this is automatic, you have nothing to do. But to start everything, you have to go to the settings. If you have good settings, all this will be managed in a very, very simple way. And you have settings about the categories of what you are buying, subcategories, different vendors, the practitioners, where do you store your items, what kind of items, we will work on that items, and you will manage different options of payment and all this. So this will help you managing your system in a very simple way. We will go to 5 steps. I'm going to present that to you like this, and after we will do it for real, because you need to understand in real how we are working. So let me first go to the settings. So in the settings, when we add an item, we need to add the category of this item, like surgery, subcategory, like disposable, item, like gloves, who is the manufacturer, who is the distributor in your list of distributors, the reference, that's very important, because when you have the reference, no need to look anywhere on the old package and all that, you have the reference. And I will work with you and explain to you exactly what is this. The lot 1, when you buy one what? One lot, one thing, what it is. And this is something like I buy one implant, okay? Or I buy one box of gloves with 50 gloves inside. So we are going to work on that, how to manage the lot. What is the lot? The second is, what is the packaging? The lot is packaged as what? In a box of 50 gloves, you have 50. So you're right, it's a package of 50. If you buy an implant, it's 1. In a box of 1 implant, you have 1. So you write 1. And you order by what? By 1, by 2, by 50, by 10. So we will work on that. And the consequences of this will have consequences in the diary, in the inventory, and also in the basket. I will show that in real so that you will be able to understand. The price, basic price packaging in euros, if you're in euros, or in AED, if you are here. Minimum inventory. So this can be done automatically. When you have less than 3 boxes of gloves, you are going to order 10. And that can allow you to automatically know when you should order something. And we add a picture of the item, so that if, for example, I have a wonderful new assistant working with me, and but she doesn't know what we're using. So she goes to the item and she looks at the pictures and she cannot make a mistake. I love to work with the same items all the time. I don't trust on sending, oh, send me some gloves, and they send me what I have. The vendor is selecting what he's going to send to me. I hate that. So I want to control what I want to buy. And this is done with the picture of that and the details and the reference of the items. We will see that in real. So let's go back to the lot. By default, 1 equals is an alphanumerical value. For example, 1 implant, we said, a box of 50 gloves, or a set of 3 tubes. You will understand why we say that. So per package of, again, is the package of what is inside the package that you receive. Okay? And based on this, you will be able to manage the basket. For example, you do a surgery, you do an implant surgery with grafting and all, and you're going to change gloves with your assistant and yourself. So if the package is 50, you are going to use 12 gloves for the surgery. Automatically, when you add 12 gloves, for example, you will get the price of these 12 gloves. And you know what is the price of the items you've been doing using a surgery. If you believe it's not necessary for dentistry, this is mandatory when we do surgery in the hospital, let's say, because you need to know exactly what are the items you've been using, what's the traceability of the sterilization, which is added to this also, and the price of this. And then you add the honorarium of the surgeon or the anesthesiologist and so on. So this is the way we are going to work now. Of course, I will go in more details because this is the difficult point about settings items. And then you are planning orders. When you plan order, it means that you are going to say, oh, yes, I will need some gloves. I see gloves, latex powder, medium free, powder free, medium. So I will need to buy that. I need to buy 10 boxes because they don't sell by 1 box. They sell by carton of 10, okay? So 2 order by 10, package is 50 gloves in 1 box, and I order 10, okay? So, but I'm not going to order now. I'm going to wait and until I will have enough things to sell, to buy to this vendor, then I will decide to send and prepare an order, okay? So planning order first and preparing and sending orders after, when I decide to do it. So you can put and memorize what you have to buy here, and one day you will be ready and you will send the order. So when you decide to prepare an order, you decide who is the staff who is doing that. So you have a responsible person and you have a traceability on that. You have the distributor, you have the practitioner or the clinic, and then you send this order. Smile Dental Clinics is going to order that. Gloves, 10 gloves, 10 boxes of 50 gloves for the price of this unit, and you send by email or you print it or both. We don't like to print. We rather like to have all that digitally. So we call that paperless, but it's not just linked to paper. It's gone to the way we are managing our system. Managing send orders. So now I receive a box and I'm going to go to management of sent orders. Orders have been sent. And you see when there is a yellow background, the order is closed. This means that this order has been received and this order has been paid. It's not only received, it's paid also. So if I want to look where I have been buying something, I have been buying, let's say, alcohol. Okay, I write alcohol here, and I will see when I have been buying alcohol in the list of orders and to which vendor I have been buying alcohol. So this is very easy to find where you've been buying the last things, where you've been buying them, and link to that. When you open here, you will get the invoice that you've been paying at that time for this order. So no more paper, everything is on your system. So here, the sent orders are there. I receive a sent order with gloves and I select the status, which is received, not received, and all that. And then I go on at the bottom and I will get the payment part. When all that is received, it goes automatically to the inventory. And the fourth step is to manage the inventory. Managing the inventory is done like this. Wait. Next one. Is done like this. Here it is. So we are in the inventory and we have the gloves here, the date, the responsible person who's been making the buying that, the practitioner, if there is a practitioner, or it is the clinic itself, where it's located, where it is stock, it's in stock, and you have the traceability number. The traceability number is a list of numbers and digits and letters. So we need to write that, and this is complicated. To avoid that, we are working now with barcodes. There are two systems of barcodes, basically. The first system is the barcode that you have like this, and you can read the barcode, and this is what you have when you go to Carrefour. The girl is presenting that barcode, and it's showing the price and the number of the item. So on a barcode, you can only store 10 to 13 characters, which is not enough for what we want to do. So instead of working on barcodes, we work on QR codes. QR means quick response code. And then instead of getting a little more than 10 items, we can put 7,000 numerical characters or 4,000 alphanumerical characters. And this gives a big, big difference. You can store a lot of information reading a QR code. This is why we've been implementing in EMedicalManager a barcode system. And if you write bonjour, let's say here bonjour, the barcode of bonjour, which is edited here, is this. And if you write bonjour, how are you today, it will become this. So look at this. I go back, bonjour, look at the QR code, bonjour. Look at the QR code, how are you today? You see the difference? And the difference in reading that with a scan will give you the text that you have on the left side. So now we scan the QR code on the boxes, on the vials, on everything we have, because this is much more easier than to write anything and there is no mistake. So now, if you want to understand better how we are going to manage all the items, we are going to manage them paperless. We don't write anything. We don't scan anything. We just scan things. That's enough. And this is how we are going to manage all the inventory and the storage. The last step is the making basket. A basket is linked to an inventory. Let's say I'm doing a surgery. I want to add everything I have been using and the tracking on what I have been using, even the sterilization putches linked to an intervention. Okay, so this is linked to the products we've been ordering, but also to the putches, and also linked to everything we've been doing with this patient and the price of that too. So I have been making several articles, 2 articles mainly on that, and there are a lot of articles on how to manage medical storage. So to go further, I want now to go with you to the program itself. So let's finish with that and go to the program, because this is what we need to look now. So the program is called EMedicalManager. You have different programs for dental, for medical, for lab. I log in here, and I have this. So let me open fully on this. So here we are going to start with the first thing, which is planning orders. When the orders are received, we go to sent orders. When they are received and paid, they go to inventory. And if we want to mix to track that until the patient's mouth, we go to the basket. Okay? But for that, we need to prepare things before. Sorry, I have an issue with my settings. Okay. Okay. I know. Okay, so now we go to settings, and in settings, we have the items. So let me show you the items. In this case, we have 14 items. Most of the time, we have in between 500 to 1,000 items. This is why it is mandatory to work with something which is digital. So I take an example of gloves here. I click on gloves, and I have the glove items. So the category is cleaning and sterilization, is disposable. We have the name of my item. So I always start with something that I understand, gloves, because when I'm looking for gloves, I'm going to type, I type gloves. I don't type latex gloves or things. I don't type latex. I start with gloves. So this is the way to identify easily what we are ordering. The manufacturer, the vendor, the reference, which is very important for the vendor, and the lot. The lot 1 equals 1 box of 50 gloves. I insist on that because it's a point that you need to understand. The package is 50 gloves per box, and they only sell by a carton of 10. So my numbers will be 1 lot is 1 box of 50 gloves, 50 and 10, okay? And the price is 8 dirhams per box, for example. You have the picture of the box, okay? You have a minimum inventory and the number to reorder that I don't use, okay? And you can add the picture here or use a URL. For example, some vendors, they have URLs with their pictures. They give you a URL, which is an address on the internet. And doing that, you automatically have the box or whatever design it is. And you can put some comments on that based on what you see. So this is one example. I go back to items. I am going to give you another example. I am going to give you an example on an implant. I have the implant. It's exactly the same category, easy, subcategory implant. The lot 1 implant plus a cover screw. So in this case, not only you have an implant, but you have a cover screw which is coming on top. So you write exactly what it is. It is packed in a box of one, and you order one by one, okay? You have the price and you have the picture. And in comments, I can add that not only I can buy this kind of package, but the lot could be with a healing abutment or analog or things like that. And these are different packages. So this is the way to prepare your items. Now I go to something you understand. It's very easy. Gloves, 50 per gloves, and implant, 1 per box. But let's go to this one. This one is a little different. This one is composite. The composite, when I use a syringe like this, maybe I use that syringe within 2 or 3 months, okay? So I don't want to have 3 syringes in my closet. And maybe in the clinic, one dentist will use one and the other dentist will use another syringe. In that case, and as long as it's packed by a package of 3, I show you, I have a package of 3 here, okay? So I have this package, I buy like this, but I don't want to store like this. I don't want to use like this. Maybe one practitioner will use one, and these 2 will stay in the inventory. So how can we do that? How can we separate that? This is not the problem of the gloves. You give a box of gloves to one practitioner and it's out of the stock. But here, we are not going to give 3 because he's not going to use 3 at the same time. He's going to use 1. In this particular case, we are going to do that in a different way. 1 syringe in a pack of 3. So I am ordering 1 by 1. So the package is by 3, yes. And we need to order 3. We don't order 3 packages. We order 3 syringes in a pack of 3 packets. Do you follow me? That's very important to understand. Doing that, you will be able to separate your inventory with no mistake. I go down and I will show you in real how we can do that. So preparing the items is important to understand, and then we are going to go to the orders themselves. So I'm going to plan orders, and I'm going to plan different orders. So I can look at orders by vendors. I can look by category, subcategory, and item, or I can look by item directly. Item gloves. I go to gloves. I have my gloves, latex, powder-free, small. The box of 50, per package of 50 in a box, and need to order in a carton of 10. What I see here, I need to fill the quantity. So let's say that I'm going to say I want 10. And you see here in stock, I have 4. So I know at that time I'm starting to make a selection of planning an order. I know how many I have in stock. And this is very important. Maybe I'm going to order something, but in a closet somewhere, I have more latex-free powder gloves, and I don't need to buy that much, or I don't need to buy them now. I control my stock starting from now, starting from planning orders. If you don't have this information, you miss the goal. I enter, and my record is successfully entered. So now I have this. I am going to order something else. I go to vendor, I go to ANPA, and I'm going to select Master S cylindrical implant. So Master S cylindrical implant, 1 per box, 1 order with the cover screw, it's written there, and I want to order 1 because I need 1 and I have no in stock, so I really need to order that. I enter and I save that. I'm going to order now the one which is complicated. I write symptom. So system is a composite, temporary composite, universal, a syringe in a pack of 3. I need 3 syringes, so I need 1 pack. So I order 3. If I order 1, they cannot send me 1 syringe. They cannot break the package. And I have no in stock, so I can confirm these orders. So now I have to this vendor, I am ready to send him an order. So I will order 10 boxes of gloves, 1 master implant, and a small package of 3 syringes. I'm ready to prepare an order for this vendor. I prepare. Who is preparing? I need the tracking. John, my assistant, is sending the order. The vendor is ANPA. The practitioner is not for practitioner. We are going to keep that in Smile Dental Clinic. We don't dedicate to one practitioner at that time. We have time to do it. We click for that and we send the order. So now we have the order here. So the order is for Smile Dental Clinic, Smile Clinic, the address, telephone number, account, everything, okay? And at the bottom, you have who is sending, who is the responsible personnel who's been sending the order is Juan, the assistant, with the telephone number. So they know to whom they should talk if there is an issue, if they cannot go back to us, if they don't have the product in stock, okay? So it's clear and you have a tracking. You send by email. Who is receiving the email? The assistant, the vendor, and the owner of the program. So everybody knows what we are ordering right now. I send that, or I can print it if you want. Okay, I print. And then we need to decide, do you post the order or you don't post the order? If you post the order, what will happen? When you post the order, in the list of items, all the items you are sending now will not be displayed anymore, okay? But if you don't post, then they will stay in the order list. In this case, we are going to post. We can save that as PDF, and we can decide to print it or not, as we don't print anymore. So we save that. So now we have nothing in the planning orders. We could have something with different vendors. In this case, we have nothing to order, all right, now, and no vendors. So we can go back to the main menu, and we are going to jump now for planning orders to sent orders management. Sent orders management is when you receive a package, so a driver is delivering something, and you receive an order. You receive, it will come on top here, okay? And it's open because it's not received, it's not paid. So we click on this and we check what we have in the package. So what we have in the package is this. We have gloves, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have 10 boxes of gloves, okay? This is exactly what we've been ordering. Master, implant S, we have 1. This is what we've been ordering. And C-stamp inlay, we have 1, 2, 3. And this is what we wanted because we wanted to separate in the same package the 3 syringes separately to put 1 syringe in some place and 1 syringe in the other place. So the status of all this is going to be the same. I have a control for all of them. Don't spend time, and we say it's received. So all this is received, and now I can click on received. But let's say that I am. You have this number, the number of days since we've been ordering. We just ordered now and received now. It's 0. But in some cases, it's 25 days. So when you call the vendor and say, we've been ordering that to you 25 days ago, please tell us what's happening, okay? So you have the information again on your order. The delivery date is today, and we are going to make a payment. So payment will be done on a document. Which document? The invoice. So we receive the invoice, we've been scanning the invoice, and now we have the invoice of what we've been ordering. I'm going to show that to you. So let me save that. I have been scanning the invoice. Is the payment done? No, it's not done. I am going to open it again. It's saving. It's received, but it's not paid. You will see the difference after. I open it again. I open because I want to show you something. I want to show you the document. So this is the invoice. I click on that. It opens in a different tab, and I have all the details of the invoice. Here, I copy and paste, and I have the invoice number, the bill number. Okay? The invoice date is today. The amount of the invoice. So let's see the amount, and you have here the amount. The amount is 1,260 60 dirhams. All the VAT in that case is 5%. But in some cases, you have 5% and 0%. It's not the case, so we keep as it is here, 1,260. I'm going to write it, 1,260. Okay? So the VAT is 5%. I write 5%. In case we have been developing an amazing tool here, in case the payment has several VAT values, like 5% and 0%, you click here and you write, for example, 500 at 0%. Okay? So, okay. And then you have in the full payment will be done, but at 5% and 0%. This will be sent automatically to the accountant. You see how easy it is to use. We pay today. The payment is done by check. Check, check. It's done. We can save now. We can save that. It's fully paid. Yes. If you want to pay in stages, you pay step by step. I can show you that. We can pay different VATs on the same invoice. We can pay by step. And when all this is done, as you can see here, the background of this is becoming yellow. This means that the order has been received, checked, and paid. Okay? But not only that, it's been sent automatically to the accountant, or if you want, you can send an Excel file to the accountant, whatever you want to do. So you see how powerful is that tool. I don't say you need to use it 100%, but you can start slowly with sending your orders like this to your vendors. We've been going through the planning orders. We've been going through the sent orders management. Now we just finished, okay? Let's discover what's happening in the inventory and traceability. In the inventory and traceability, the last order we've been doing will come on top. You see the C-stamp inlay is coming here on top. So I am going to tick on this, this, and this, because all these three items will get the same reference. And what I'm doing, I am saying that, okay, this assistant has been putting that in the in Smile Dental Clinic storage in the location of the stock room, and I need to fill the traceability. So the traceability is there. I show you. I have this. The traceability is the QR code. It's not a QR code, it's D1 code. Okay, I have the scanner, and I am going to click on that. Clicking on that, I have now the traceability, which is written here. And instead of typing all that, letters and making mistakes, all this is coming in one time automatically. What is not coming, and you have to do it like this manually, is the expiry date. the expiry date is there. You have the expiry date somewhere here, and you write the expiry date. So in this case, the expiry date is 23rd of March 23. So March 23, March 23rd. Okay, and it will be done for all these three. What I do now, I just save, and I have been entering this in stock in the system. So it's in stock, excuse me, I didn't write it, in stock, and and this one will be in use, and we are going to make it change from the stock room. It will go to Mr. Paul, Dr. Paul, and it will be in office one. So now this one is changing, okay, and it's moving to someone. I save, I have only two in stock, and I have one which is in use with a dedicated doctor. This can be used in a clinic. This can be used in any kind of medical activity. It is saved, and you can track everything like this. So in stock, in use. It's for excuse me, Paul, in office number 1. That's it. So this is saved. Now let's go to the second one. So the second one is the Master S implant. Master S implant, okay, I put it in the stock. I put it in the stock room, and here I am going to read. So we have this. This is a box, and it is mandatory by law today to have a QR code. The QR code is there, you see, the small one. I am going to scan the small one. Voila. It is scanned, and it is scanned here. And here you have the details of what we've been scanning. Of course, it's much better to scan than to start writing all these things. So I need to add manually the expiry date. Expiry date is on March 2023. So I go to 23rd, expiry date March, and I can save it like this. So where it is in stock, and I can save like this my stock. It is saved. Confirm. The last thing is the gloves. We've been ordering gloves, so we have 10 gloves. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have 10 gloves. So the gloves are in the stock room, and we are going to make the same thing. So you have the gloves here, you have the box. We've been receiving 10 boxes. So we look at the code. We have the code here. We are going to scan the code. I scan the code, and it's written, and it will be written by default to all of them. So the expiry date is in 2003. So 2003, it's in May 31st. I select again in stock, and all this is in stock now. You see how easy it is to track 10 items at the same time. And it's here. And now I'm going to show you something. I want to take something out of the stock, like a system inlay, for example. I need to find a system inlay that I have in stock, but my list of stock is very big. I go to traceability here. I take what I have in stock in my closet or in my drawer, and I am going to make a search on this. So I scan it. Okay, I'm going to scan the implant. It will be better. I'm going to scan the implant. Voila. And now I have the implant. I'm looking for the traceability in the search on top here. I've been scanning that number. I did not write it. I've been scanning it. And then I find my Master S cylindrical implant, which is here. And instead of in stock, I say it's in use, okay? And it's been sent to Dr. Paul. Let me do it, voila. Or Dr. Paul. I save. So we've been changing something which is inside the inventory from the clinic itself to Dr. Paul. If I want to look at who's practitioner, Dr. Paul, we see that Dr. Paul inventory is including the Master S. Okay. So forget about working with Excel files. It will not give you all these tools at the same time. So let's go to, you remember, we've been starting with the purchase order. Then we went to the delivery. Then we went to the payment. Then we went to the inventory. Then we went to the expiry date. I did not cover that. Expiry date. So let's see. I have something which is expired, like this. The date is not 2023, it's 2001. Okay? So I have this in 2001. This is expired. So when I have something which is expired, I click on save. It's updated. Then it is a red background. The red background means at a glance, no need to make any search. You know that this item is expired. Okay? As long as it's expired, you will see that in the reports, you have export in use item. I click here and I will have the export in use. It was in stock, but in use is the same. So you can find all the in use or expired in use or expired in stock items, and you find them here. The system is expired and you know what's the expiry date. Okay. So you can print that, of course. And when DHA is coming to visit you, you go to export to expired items and you will get all. And they ask you, because this is mandatory to work in conformity with legal authority, what's your inventory? You click on quick inventory. And on click inventory, you will have the list of your inventories, item by item. So for the gloves, you have how many? You have 14. You don't have 14 lines. You have one line with 14 here. And on top, you have the amount of your inventory. And this will allow you to know if you can order more or if you've been ordering too much. So again, this is a tool to work in a good way in your practice, knowing exactly what's happening, just clicking on the inventory. If you want 2 days inventory, it's a little different. It will give you the same items, but line by line, one box, and you will have 14 lines like this. Okay, so we print that when we want to check if we need to reorder some items. I ask the assistant to print a quick inventory, and very fast we know where we are and what we need to buy and what we have in stock. Allez, let's go to another one now. We go to the basket. On the basket, I take an example of this basket, for example. The basket is a list of things we've been using, items, okay? And the items which are here are coming from the list of items that you have in stock, okay? And having all that in stock for yourself, okay, allow you to use these items. And then you're using anything from here. For example, in a box, you've been using 12 gloves in the box of 50, okay? You know where it's coming from, it's in use, and you have the price dedicated to that. Okay, it's calculated automatically to 50 divided by 12, and you have 12 items. You have also the pouches. The pouches, because in the sterilizing system, you need to have the pouches. So you can add the pouches, these pouches, and you say, okay, I have been using these pouches. I validate them. So I save the basket, and I am saving the pouches, the sterile pouches, which have been used to treat this patient. Okay. And like this, we have the sterilization tracking starting from the sterilizer to the patient, and we are closing that with the use on the patient himself. So that's the that's what I wanted to talk to you today about the starting from the planning, sending orders and receiving all your orders, working on the inventory in different ways, and ending that with the basket to the patient. If you don't want to edit the basket, no need, okay? But you have to know where is your inventory, where and when it's been used like this, and on whose patient it's been used also. So this is the simple way to see the different tools that you're using, and this is used every day. Every day you use that. Planning orders, receiving orders, checking inventory, and working on basket. Okay, every day we work on all these things. So I would add that this is also mandatory to work in a secure way with the SSL system, the double encryption system. All this is protected. You are hosted on Amazon, and finally, I have a question here to talk about the price, how much this costs. The price of this is 250 dirhams per month. So it's not a matter of investing anything. It's just a matter of working in the good way with the tools which are available today. I thank you for your attention. We will do more webinars like this, and we will focus on different topics, and step by step you will be allowed to know more and how you can work in a better way with your system and your favorite system. Thank you for your attention.